Riu arwrau aria meyandikithitie rungu rwa mubango wa SHA no mahote kwamukira motungata thibitari-ini cia andu kiumbe thutha wa ngwataniro ya RUPHA kwiranira gucokereria uheani wa motungata kuri amemba a SHA. Ona gutuika gutiri marihi mamukirite ngwataniro ino iguithaniirie kweheria mukana uyu kurumirira kiraniro gia President muthenya wa ira ati thirikari ni kuriha thibitari iria irarandura mathiri ma thi wa ciringi milioni 10 kwa ihinda ria thiku 7 ciukite.
Issues of the portal being friendly, issues of primary healthcare fund, issues to do with registration of patients. These are issues that remain pending.
Ona kuri uguo ni matheretie na kuga kiraniro giki kingiaga gukinyanira matigukorwo na wiki otiga kurugamia motungata maya ringi kuona matikoretwo na uhoti wa gukinyaniria motungata ma ikiro iria ciagiriire kumana na wagi wa mbeca.
It will help if there is equity in the process, so that all providers feel that they have been treated equitably, but so that patients also don't get inconvenienced at facilities that will continue to say that they are in financial distress.
RUPHA yarugamirie motungata ma SHA tariki 24 mweri muhituku kurumirira thirĩ wa muigana wa ciringi bilioni 30 uria weyonganiriirie hindi ya motungata ma kandi ya NHIF.
We have discrepancies between what the authority says it has paid and what the claims submitted are. Those discrepancies persist. So we do not want to be involved in a shouting match with the authority. We want the data to speak for itself.
Maya magithiaga na mbere ngwataniro ya thibitari iria iri rungu rwa uramati wa makanitha ni irutite notithi ya thiku 14 mathiri maria irarandura ruhonge rwa SHA makorwo marihitwo na kwaga uguo marugamie uheani wa motungata mari rungu rwa mubango uyu.
Serikali kwa upande wake haijukumiki itakikanavyo. Tumefika mahali ambapo tuwaona tumepungukiwa na tunachukua msimamo ambao kama dini hatungependa kuuchukua.
Provide a transparent portal dashboard for invoice tracking that can be downloaded for review by hospitals.
Kuringana na urugamiriri wa thibitari ici makoretwo na ihinda iritu kuheana motungata makinyaniru kuri arwrau amu ihinda-ini ria mieri 5 iria mubango wa SHA urutithitio wira. Thibitari ici ciamukirite o gicunji kia 50 harĩ 100 kia marihi ma motungata maria maheanite na thengia noguo thiri uria weyonganiriirie hindi ya motungata ma NHIF wa muigana wa ciringi bilioni 3.8 nduri warihwo.
But what do we do when we have to pay our debts? We have to keep important facilities like the dialysis systems going and very expensive per patient.
Gukiri uguo mahinyiriirie marihwo mathiri niguo motungata ma urigiti makinyanire gutari na muhinga. Handu-ini ha Kameme TV ritwa riakwa ni Wambui wa Njuguna.